podcast.
Thank you, Samir.
I'm sure everybody who's watching this already knows who you are. You're basically a celebrity in the city. But I want to talk to you about what kind of a world you come from, sir.
Basically, I came from a very small place called Digras. It's a very small town which was not even a taluka place when I was there in this, that particular, we can say a small town. It had a population around 20,000 that time maximum. And by the time I turned 16 or something, it turned out to be taluka. So you can say it's a small village come small town. It's in the Yatmal district. It was the heart of a cotton market. A lot of ginning pressing and all those things. So it was a good place to be. We had excellent school. I think great neighbors. And I think in the town, everyone knows each other.
Right.
That was the thing of those area where everyone knows who I am, who's my father. And I think it was a very cordial relation with everyone and very great upbringing in terms of community part.
Right, sir.
Great schooling as well.
Simpler times.
Yes. And I think we had great teachers. The one thing about that particular town was that we had maximum students going to engineering, medical and other fields from that small town because of the great school. And we had a very good dedicated teachers who had given Rashtrapati awards and all those things for great being good teachers. So the good part was small town, but good teachers, good community, and I think parents. My father was a doctor, mother was a homemaker, and overall a great family atmosphere plus and friends. So that was the place I was.
But so you come from a medical background.
My father was a second generation of doctor.
Oh, okay.
My grandfather was a doctor in the British Army. He probably died in Hiroshima. Nuclear bomb.
Really?
Yes.
But
he was serving British Army then. Then my father was a doctor. He was a MBBS from Nagpur. Certainly a small place because of the early. He lost his father when he was only 1 year old.
Right.
So he has to work hard. So he didn't do any PG. Got into the medical practitioner after MBBS, and was doing very well. But unfortunately, I lost him when I was 17 year old, when I was first MBBS. So then the hard part starts in life. But anyway, the early year was really great. I still remember those, my town, my Bangalore, good place of living, a comfortable living when we had. That time, for those years, we had a car in 1975, 6 and all those things. So it was, I think, a great going that time. And I really have great memories of Digras.
do you still have that ancestral house?
No, we sold it because no one was looking after that plant and it was falling apart. So we did sell it, but that was the last very painful part for us. But I think we still have connection to those people who were there, our neighbors then.
Right.
But great memories of childhood.
Then why orthopedics, sir? But
what happened, I was looking for some specialty because since my father died, we actually had a lot of money crunch. My brother was a doctor, always educating ourselves, and my mother was homemaker, so no income. So we thought we'll do some specialty which will give me a direct specialization,
right,
rather than MS surgery and then getting MCH and all. It was a long route. So, and I was interested in orthopedics, of course, because one of my cousin brother is an orthopedic surgeon. Quite happy to see him grow. So I thought he has a good career, and then straight away 3 years specialization. I can start earning early. So that was all the, but I think I was a topper of the University of Mumbai for surgery. I had all the choices in my world. So, but I took orthopedics.
And then when did you decide to go to UK, sir? What was the opportunity?
That was the very, I will share an interesting story. A lot of my seniors from Nayar Medical College used to go to UK on a training basis because of the Dr. Talwalkar. He was one of the guides and he had a very good contact in UK. He used to send the people to UK for training and he was really good. So I went actually because of my both financial condition and educational hunger. I went and spoke to him when I was intern actually. Sir, I'll come to Nayar, but will you send me to UK?
Oh, that was the condition.
That was the condition. And he was amused to see a young fellow coming in, walking in. Those days, talking to bosses was almost impossible.
I know.
But I said, what will happen? He will say, no. But he said, yes, I'll try and do that. You first get in orthopedics. And that's how I got in orthopedics in Nayar. Of course, I did well for myself and for him to send me to UK. I passed with a gold medal in orthopedics in University of Mumbai. And next year I was in UK for my training, and then the UK journey started. So it was Dr. Talwalkar, my grit of earning and having education at the same time because of the financial condition I was going through. So it was both, to earn money, to have knowledge, and I always had a dream of coming back to India. I never wanted to settle in a foreign country for good. And luckily my wife, Dr. Prachi, she's a surgeon as well, and she also had hunger to come back. When both of us were hungry to come back, we came back after 8 years of UK stay, but that was pre-decided more or less.
She talked about this when she was a guest on the podcast.
Yeah.
She did tell me about your UK story.
Yes.
But funnily, sir, I don't know if you know Professor Keshav Singhal. He is my father's batchmate.
Right.
He is in London.
Okay.
And he's settled over there. So the ERAS protocol.
Yes.
He was the first one to implement it in
All right.
London. Quite senior now. So did you ever have an opportunity to talk to him, meet him?
No, unfortunately, no. I was in nearby London. I was in Liverpool. I was in Cardiff, and then came back again to Cardiff. So a bit of a moving around, but Liverpool area and Manchester was my main area where I got trained in orthopedics. It was a great time, but everything has to come to an end because we realized that we are not the first citizen there as such. And coming back was a great opportunity because India was just rising probably. And we came in time. Of course, it was not easy to come back after those easy opportunities were there, easy working patterns, probably a more structured working pattern, I would say, reasonably good money. But then we thought our country is our country. And after, I will tell you, what prompted me to come back 100% was 9/11.
Oh, really?
After 9/11, though they knew we are Indians,
Yeah.
we are Hindus more or less, not those probably other community. But the people in the ward and all the staff and sisters and everyone were talking about why you are here and why you are there and why don't you go back.
The brown
the tone changed because they were very angry probably.
Yeah.
And they had nothing against us, but I think overall tone against the immigrants were different that time. And I said, this is the first instance. They never said anything directly, but you can make out the air has changed. And so I thought, why not go back, ask our own country, no one can say anything to us as such. Of course, we had a great time in UK in terms of learning. I had opportunity to earn something to get back to Nagpur. We had a daughter who was born premature, but UK gave us a life. Like she was born, she's raised there for 3 years, and she did very well because of the care. Because those days, care of that kind was almost impossible in India.
True.
So I think we should owe a lot of things to UK as well. But I think the main part was education, daughter, and somebody back home.
But when you came back home, sir, you came from a very structured practice. And even today, the practice in India is not so structured as it is in NHS. How difficult was it to readjust?
Once we decided to come back, my theory was to burn all the bridges back.
Okay.
So we didn't leave anything there. We almost withdrew everything what is there. We had only 6 months left to get a permanent residency, which we refused because I know once I had residency, my feet can turn back again, which I didn't want to do. So once I have no way to going back, I said, let's fight it out. Once you are on the soil and you know you have to struggle, and your mind is made up that, okay, whatever happens, I have to succeed here because I have nothing left there as such. And that was the whole point. To get into the battlefield, you have to be prepared full-fledged, that, okay, that whatever happens, do or die, but you have to be here. And that's what the whole pattern. See, the point is when someone comes from the foreign country, they believe there will be red carpet. There's no red carpet in India. That time there's no corporate as well. Very limited places to go to. But once you start, then it is difficult. But once you get going, I think that passion, that perseverance and hard work, you cannot, once you get that going in India, success is with you.
So when you came back, did you start your own hospital or you joined somewhere else?
No, I was doing a OPD practice with Dr. Mahurkar's Avanti Hospital, and then I was operating here and there. Gradually I started my own place, a small place, and I used to move around every weekend to other cities just to know to let the people know that I am there. I used to do scopy, going to Nanded, sitting in the bus all night with my boy and taking all the instruments with me. Akola, Amravati, Pusat, Yotmal, Nanded up to Nanded, sometimes Aurangabad for surgeries. So we did a lot of hard work as such. Traveling in the ST bus or your small car that time was not easy. But then once you decide to do hard work, you have no other options. And then the only point to focus is to succeed in what may come in a right way. In a right way. So letting the people know that I am there, I do those things, and gradually the name spread, word spread, and once you give results, gradually people start coming. But it was a difficult task because you are there. You used to give only orders, do this, do that.
Right.
Here suddenly you have to do everything from bandage to plasters to surgery to look after post-ops. So one man show, but it worked, and I'm happy for that.
So I want to go to the clinical part, sir, because I want people to take away as much of knowledge as you can share. So most common surgeries are in orthopedics is usually joint related. Mostly it's a knee or hip, that's what you get. So before we go there, I want you to explain what exactly happens inside a joint as it wears out.
Okay. As persons start walking from birth onwards, as he ages as well, every part in the body wears out. Like your hair start grain, the heart start having a wear and tear, every muscle part. So does the joint. Because joints are used for every day for locomotion. It's a maximum used one of the other things in the body, especially the knees in Indian, hips and in Caucasian and other joints as well. So it wears out. Some people wear out faster, some people wear out lesser. People who are having obesity, hereditary patterns, like a lot of people have their parents who are bone-kneed and everything, they will have more wear and tear. And people, some unfortunate with rheumatoid arthritis, suffering with arthritis disorders and all, they will wear out faster. So wear and tear is a natural process, aggravated in some, leading to a disorder where they are unable to walk, pain and deformity start coming up, and they are very painful to get along. And that's what happens in the joint. Especially in India, it is most common in the knee joint, then follows the hand and the feet as well. But those are not so common compared to knees and hips. Especially knees are very, very common.
Weight-bearing joint.
Weight-bearing joint, yeah.
So how do you differentiate age-related issues versus a joint that needs immediate medical attention?
I think the person in a younger age group, if you look at the 20s and 40s,
right,
they have a sports-related injury. They had a fall from a bike, something happened in badminton or football or something like that. The commonest part is losing a bike on a bike or something, especially the heavy bikes nowadays. The knee get twisted and all those things. So those are the people who require immediate attention because of the ligament injuries and the sports-related stuff they have injured. That's mainly ligaments and cartilage part, meniscus, what we call. So those needs immediate attention because they are very painful, difficult to walk. They really can't do much. The knee become unstable. That they have a feeling of giving away while walking or turning or dancing. So those are who requires immediate attention, and those are the kind of surgeries we have to do in early phase. In those early phase, wear and tear doesn't happen. It's mostly a injury-related pattern. Once you cross 50s, and then the wear part starts. So unfortunately, in a rheumatoid who can come up in 20s also, they have wear and tear because of the arthritic process, which is a pathological process of damaging the joint. Those also require attention in terms of medical part, but sometimes surgical part.
Right.
The main crux of the osteoarthritis comes in 60s and 70s, where aging process, wear and tear, the hereditary pattern and the weight matters. Of course, the people who had injuries in the past also are more prone for a wear and tear because of the imbalance of the joint.
True.
So those are the patients who suffers early.
Right.
Like a lot of people with the kabaddi players, kho players, previous injuries, untreated injuries, they will have instability leading to one wear of the joint more than normal people. So those are the ones who require gradual attention, but they are the one who comes in 60s and 70s.
True. Is knee pain always arthritis?
No. A lot of knee pain actually come from the deficiency of vitamins, muscle weakness because of vitamin D, B12 deficiencies, which affects overall the function of the knee joint. So people feel pain around the knee joint, but it's a muscular pain many times because of deficiencies. Once we treat deficiencies, they get better. Sometimes it's an overuse syndrome. A lot of people do marathons, a lot of people do a lot of squats and everything, which can lead to early pain. Of course, they can be rested and treated eyes and all those things. Injuries, as I said before, requires still different attention. So not all knee pain is arthritis. Young patients, injury, middle-aged patient, deficiency, old age, maybe wear and tear along with deficiency.
True.
That's how you look at it.
So if somebody has knee pain, should they push through it, or should they rest, or should they get a consultation?
I think whatever pain here and there aches occasionally, everyone, even including doctors, take their own time to come to a doctor as well. You just can avoid it. Simple logic is you put ice packs, take it easy. Don't do things which is causing you more pain. Like don't go to the gym and run around. Oh, काटा काटे को काटता ये बात इसमें नहीं होती है. So don't, lot of people do that. Okay, I'm going to do more vigorous. No. You should be resting that part. Ice is the best option.
Right.
First and foremost, I would like to tell the viewers that ice is the main therapy for any joints. Compared to the hot, I think the ice is the main part, which will decrease the inflammation, swelling, and you feel better. A lot of people do other way around. They put a lot of hot packs, which will cause more inflammation and more damage, or I will say more pain. So I think one should start first easy, ice packs, take occasional tablets, whatever maybe you have, occasional painkillers once or twice, maybe. If it doesn't settle down, I'm sure one can see a doctor, because it's easy to in India, not unlike UK or US where you take a month to see a doctor. You can see a doctor, but don't rush for every small thing to a doctor. But yes, things which persist more than a week, I think one should see a doctor.
Have to look at.
Yeah.
So at what point does a joint needs replacing? When do you decide?
I think the only decision which makes the joint replaceable or not is the pain factor. Of course, not every pain, but the pain which is coming from a degenerative joint, which is worn out, you are unable to sleep properly, you are unable to do daily activities like walking, going to the bazaar, or walking around the shopping part. And as soon as people start avoiding the daily activities, like going to social circles, going to marriage because of the pain and walking pattern, I think that's a point where they should consider consultation and possibly a joint replacement.
Are there certain non-surgical options?
Yes, we do have non-surgical, which we always try first.
Like?
Of course, initially calcium, vitamin D, replacing those nutrients. Make sure you offload your joint by occasional brace or proper footwear. Then basic physiotherapy and occasionally injections. The injections can be different. It can be a simple injection of steroid to decrease the inflammation in the joint, which can last for 3 to 6 months. Same with the nowadays, a lot of people must have heard of PRP, that's platelet-rich plasma, which is derived from your blood sample. That also works for a few months. Nothing is a panacea for a wear and tear, complete wear and tear. It is just a time-buying procedure. Of course, the main part is losing weight, and a good physio will help you, apart from medications. Now, there are a lot of medications which are chondroprotective. That means it will protect the cartilage from wear and tear, which are available on the counters, and those are good ones to a certain extent. But nothing of those sort can completely cure your very bad worn out knee. It is for a moderate to moderate to severe knees in early part. Once you get going with the bad pain, unable to control with analgesics, one should think of a joint, because by taking a lot of analgesics, one should be aware of a kidney.
True.
In India, if you see the statistics of kidney damage, or people who are suffering from kidney damage leading to dialysis, 80% is because of the uncontrolled painkillers. And that is because of the knee or headache or some sort of pain from the body.
True.
So be aware of that, because you are not only damaging yourself, the kidneys you have to take from your relatives.
I think Crocin and Dolo are highly abused.
Abused, yes. There are a lot of abuse, because people believe this across the counter. A lot of elderly women in the house tell their granddaughter or grandson, "Arey, jaake goli leke aao." That means, and sometimes they take steroids, sometimes they take a lot of pudi churn, which contain a lot of steroids. So I think be aware of what you're taking, but of course, doctor consultation is good enough initially.
Sir, I remember reading about sodium hyaluronate injections are also.
Yes, those are the lubricant injections, which is the basic content of a collagen part, which is a part of a cartilage. So it gives some certain period. See, all this injection, sodium hyaluronic acid, PRP, steroids, they're all 3 to 6 months to maybe 9 months. They are not, and you can't take again and again for years.
It's just not repeatable.
Once or twice, that's all it is.
Okay.
There are limited doses for everything.
Okay.
Beyond that, it doesn't work. So those are ones which can probably protect in early 40s and 50s. Once you're 60, 70, those things are pretty useless in most patients, I would say.
But What if somebody waits too long for the surgery? Is that a problem as well?
I think, see, everything which is you destroy more is not easy to rebuild, as simple as that.
Right.
So once if you are in a bad shape, you should come early. And in India, we have a tendency to carry on as much as you can. Because a lot of people nearby you says, जब तक चलता है तब चलने दो. That is not the way, because you're not चल रहा है. You are just lying in bed or sitting on a chair all day, and you are just actually doing more damage to your joint. What happens, I'll tell you what is most important is, a lot of people come so late that the joints start cracking. The bones start disappearing and there's a stress fractures. So when you come with a bad deformities, we can still do it as a good surgeon. But the earlier the better rather than too late. We are seeing so many people who are coming late because they believe that the surgery doesn't work. Once they see a patient who's 5 years, 7 years down the line, they get courage to come back.
Why do they believe surgery doesn't work?
Because in India, first thing is always no, no. If you tell an Indian that these things work, he first says it doesn't work. Because there are two factors. One, a fear factor for many people, and secondary monetary issues with few of them. Unfortunately, fear is more than monetary issues for many people who are in urban area. Like I can tell you, a lot of people who are educated also come late because they believe जब बहुत ज़्यादा होए तब जाएंगे, but बहुत ज़्यादा कभी. It's like in your roof, if you have a small leakage, you immediately attend. You don't wait for roof to fall down. Something like the joint. I think there's always an optimum time.
Right.
And if you are educated, you have no issues with the monetary part, you can afford a surgery, I think you should come early, because more the damage, more the trouble later on. But I'm sure we can still do the magic of getting them right, whatever they come in.
What do you think is the single biggest mistake people are making with their joint health?
I think they don't look at it when they're in early 40s. I'll tell you, most people who come to in early 40s with the joint pain, with obesity and poor nutrition, especially perimenopausal women, because I always tell them, you're going to put off 10 kilo weight in the menopause. So kindly reduce now to accommodate that weight. They don't look at it. When you're young, you tell them to lose weight, they say, no, nothing, no worries. I'm absolutely good. But they don't realize that this is not going to go down once you have knee pain, because you can't work harder. Neither you can run, you can do gym, you can do anything. So the knee pain is only controlled, and if you control the weight when your knees are good, it's going to be okay. Once your knees are bad, you can't take care of the weight because you have no way to mobilize yourself, do a jogging or any gym activities. So early part is early 40s. You should start looking at your belly and all those things to make sure you are losing weight, to make sure your joints are not suffering because of the weight. And then if it's unfortunately hereditary, you can't change your parents, but you can do something about your weight, nutrition, muscle control, and exercise of your joint, which is in everyone's own virtue. They can do that actually.
But you talked about perimenopausal.
Yes.
Why do we see postmenopausal arthritis so common, at least in India?
I think osteoporosis is one part. If you see most people don't take care of a calcium, vitamin D in a perimenopausal part. If you tell anyone to take calcium every day, most women go to kitty party and they say, no, they say only take for 2 months holiday. Something doesn't work like that. Calcium is a daily requirement of your body. You should take 1 tablet daily if you don't take enough consume in your food part, which is not normally easily possible. So everyone start taking calcium on a day after 40s, especially 45 for sure. Vitamin D, a good resorptive measures like osteophos and all those things, the metabolic we have, the pharmaceutical we have to control the osteoporosis. If osteoporosis becomes better, the bones are stronger, they don't wear out faster. If your osteoporosis is bad, they start deforming, deformity leads to altered axis and leads to more wear. So osteoporosis is a single cause which can lead to a wear and tear faster than expected in a perimenopausal or postmenopausal women.
Right.
So look after your calcium, look after your vitamin D, look after your bone health, and your backache and the joint health will improve dramatically.
But should you have just calcium tablets, or having D3 supplement also helps?
I think D3 supplement is very much essential. We have free D3 in India, but we don't take care of that because nowadays either we are putting a sunscreen or we are in the indoors with the AC and everything. So I think today, though the sunlight is free in India, unfortunately we have more than what the world has, but we don't take care of that. So we should take vitamin D supplements now.
Not D3.
D3 is good.
D3 is
good, yes.
Okay. So let's come to the surgical part. What is the difference between a partial TKR and a total.
Yeah, there are TKR, there are two types. One is a partial, which is a partial knee joint, which is only one part of the joint is involved. And
That's a joint, na?
I'll show you.
Ah.
If you see this is a joint.
Right.
This is the middle part, this is the lateral part, means the outside and inside part of the joint. And there will be a patella here. If you see, the joint is wearing out more on the inside in 90% people. In a rheumatoid arthritis, only where they have a lateral wear and tear in many people. But if you see only one part of joint is involved, we can only replace that part of the joint, and we can save the rest of the joint for future issues. But if you replace a good unique joint or partial joint, it can last your lifetime as well. So it's a good replacement provided you come early. If you have involved only one compartment, we can do that. If the both compartments are gone, we really can't do a partial knees. So then we have to come for a total knee replacement, which is a complete knee. So partial means one compartment, total means all the compartment, and that looks, the joint material of that kind looks like this, where we have a total joint for both compartments. That's the inside and outside. Both compartments can be replaced.
This is the same thing reconstructed.
We can say we can put this part of the joint onto the surface which is damaged.
Right.
It's like, in a simple way, we just change the surface.
Yeah.
We don't remove. Like a lot of people have a belief that we just remove the whole joint and put it back. No. We only change the surface.
Right.
I'll simply, a lot of people, I tell them, we are just changing the tire and not the whole wheel. So we don't take the wheel out. We only change the tire part which is worn out because of the aging process. Similar like any car issues.
True.
So that's not a complete replacement. We do a surface replacement actually. That means a total knee replacement, but it's a surface change. We don't change the whole joint. We don't cut the ligaments. We save the ligaments and we put in a joint to work like a normal joint. And this works in this particular joint. If you see, look at this knee joint, it will work this way. This is flexion. This slightly rotation as well, but you can work like this. And that's how the joint works in a total knee.
Achha, for most people, what material is that?
Okay. We have 99% is a cobalt chrome with a nickel alloy, which will last your lifetime.
Right.
It doesn't wear out.
Right.
Secondly, the most important part of the joint is the plastic which we put in between the two.
Right.
If you see this plastic, this is the only one which wears out. So nowadays we have highly cross-linked poly, which is a material which doesn't at all wear for years and years. So this can last for lifetime. If you have a good poly from a good company, it will last your lifetime, and that's what is going to be the wearing part. It has to be there because a lot of people believe there is only metal and metal. No, it will start banging on each other. This is the way it works. So this is the loop, the middle part, which is important part apart from this two.
But titanium is also you have.
Titanium is not in the knee joint. It's in the hip joint.
It's a hip joint.
Yeah, titanium joints are for the hips because they have a elasticity of modulus of elasticity as close to bone. So we use titanium for the hip joint. This is mostly cobalt chrome. Occasionally we have used ceramic as well, the ceramics as well, and they are occasionally coated with gold coating.
Yeah, they are becoming quite
fancy, but actually that is not the true gold.
I'm trying to figure out what is the value of that.
It's a nitride oxide.
Right.
It has no value as such. It's a new thing which they have specially marketed in India because of people have actually a lot of
craze
for gold. I think that makes them will put gold, but no, that's not the one. It is not. There are no long-term trials. The long-term trials have the cobalt chrome, which last your lifetime.
Okay, nice. So it is the surgeon who will decide, obviously, based on the presentation, कि आपको partial TKR or full TKR.
Yes, I think surgeon decides, but especially in Nagpur area, the patient also decides because see, unfortunately the cost of both knees are same.
Right.
So what lot of people when they are ready for actually UKR or partial knee, they say, Doctor Saab, ek bari pura kar do. So that is not wrong as such because sometimes you can have a joint problem on the other side as well, for which you need revision surgery. But yes, some people decide on their own. Sometimes we decide for them. So it's a mutual decision. But I think yes, I think 20% people can be a candidate for a total knee, partial knee, but 80% are not for them. And for them, the total knee is the only answer.
So how does hip replacement differ from a knee replacement?
It's the same thing. We change the whole ball and socket joint for a hip joint. And I think that works wonders for people who have a bad hip arthritis. In an area like us, We have sickling, which is very, very common. For them, it's avascular necrosis. We don't get arthritis of joint compared to a knee joint in India. I think the Western country has a huge population who have a hip arthritis. We have a hip disorder which leads to arthritis, which is a avascular necrosis because of alcohol, because of sickle cell, because of uncontrolled steroid use. Unfortunately, with some steroid use, because which is judicious use of steroid also can cause those things. And sometimes some unfortunate people get AVN because of any reasons. Especially post-COVID, things are really bad for a avascular necrosis of the hip joint, which can lead to a very bad hip collapse.
But why are we seeing a rise in AVN in young adults nowadays?
It's possibly because of COVID.
Okay.
And unfortunately, sometimes alcohol as well.
But I mean, there are studies saying that the younger generation mein alcohol consumption has gone down, especially in the Gen Z. Because the alcohol manufacturers saying their consumption is down by 25%. That's a lot for them. So probably the younger generation is doing all the right things. I don't know.
I don't know, but I doubt anyone can do a right thing all the time. But yes, we do see young patients coming up. I think post-COVID is very bad.
Okay.
Yeah, COVID is the main cause for at the moment in the young patients.
Oh. So do you think can both knees be replaced at the same time?
Yes, we can replace both knees at the same time, provided patient is fit for that.
Okay.
There are certain criteria where patients should be having a good heart condition, where there is no major heart issues. Your ejection fraction for the heart should be good. Otherwise the system like pulmonary system like lungs, kidney and liver are working well. There are very fit patients who are good for both knees. In India, we have to do both knees at the same time in many patients because of deformity. Like a lot of people can have very bad deformity where they can't walk with one knee straight if I operate and one knee bend. So there's no way they can go around walking with the one good and one bad legs.
True.
So for them, we require both to be done. And I think with judicious pre-consultation with a cardiologist and a physician, I think we can do it successfully.
And what is a revision surgery, sir?
See, if the joint fails, which can happen because of 2-3 common reasons. One is unfortunate infection. One is a wear and tear because of using a not so good joints from good companies where the wear of the plastics really comes out. And third is the alignment. If your knees have been put in a wrong alignment in terms of curvature, the things can go wrong for the patient and the knee will wear out quickly. That's called aseptic loosening. So the important part is to get it right in the first time. Get it right in the first time for first one, alignment. That means the knee should be positioned properly. Secondly, the infection-free, control-free environment should be there where you have a proper laminar flow theatres, good systems, a surgeon who is good enough in terms of taking care, quick surgeries. We can't prolong surgery for hours and hours and still have infection. Good OT setup. And the third part is a good implant. So surgeon, implant and environment, all things put together can lead to a very successful joint which can last a lifetime for patients.
How long does the procedure take, sir?
See, for an experienced surgeon, probably I would say now 30 years almost in the job, I would say it around 20-30 minutes for one knee. But I think if you are inexperienced, you can take for hours, but I think a good surgeon would not take more than 45 minutes to 1 hour.
That's
for
quite
one
fast.
knee. Yes, I think with time, I think it's a matter of day-to-day affair. So for patients, it's a huge thing. But for surgeons who do daily surgeries like 4-5 surgeries a day, it is around 30 minutes job on an average.
I was talking about this to some surgeon, I forgot. I mean, I am experiencing this now. Most of the times when I am operating, it's happening at a spinal level. I mean,
yes.
And I always think when I try to actively do something, kaitari gadbadta. So it's better you let go and let it happen at a spinal level.
Yeah, see, there are now, if you do a particular job every day, it's going to be 99% spinal level. Sometimes the cerebral part get activated because of the certain anomalies we see in the procedure. In a patient or a procedure or during surgery, we see something which is not normal for that particular patient, and then we have to think about it. But yes, if you say 90% procedures are reasonably straightforward for most patients because we do a day in and out same thing.
Yeah.
But yes, there are complexities, and
Obviously.
I think we are ready for that. Not
Obviously,
a problem.
obviously.
Yes.
Because I was trained at a high volume center, sir.
Yes.
So we had almost an OPD of 600 on a daily basis and an OT of close to 180 to 200 on a day, and it's only 2 units. So we were operating alternate days.
Yes.
And the point was, we used to start the OT at 8:30, 9 o'clock, and by 2 o'clock we were done. So we were trained to operate high volumes, very fast, very clean. And that actually helped. When I came back here, I realized that most of the things are happening at the spinal level itself.
I think high volume centers will do better job most of the times because they know in and out everything. Secondly, your staff is more, they're aware of everything what is going to be next. So next step, when people are aware of next step, things become very easy.
True.
Like in our setup, we don't have to ask for any instrument. Next, you just put a hand and instrument comes in because he knows the pattern of my work. So that's the best part. If you are a high volume center, things become very easy for everyone.
100%. Let's talk robotics, sir.
Yes.
I think you were the first to get robotic surgery in Nagpur?
We were the one first with the SOBS-based system.
Right.
That's called Wellness from Johnson & Johnson.
Right.
I think it's the first of India actually. Or Asia. Because only in the Pacific they have launched in Australia before and US. We were the first one to get in the Asia part. And we were the first one to buy in Nagpur and in India. So it was a great moment for us because it was a very risky proposal compared to the cost involved. But I was pretty sure that we have to go with the technology. For years I am using a navigation. I was using the computer navigation, which was the technology of that time, which was perfectly okay. But now we have to move on to robotics because that is the new future of it. So we started with robotics 3 years back. And I must say proudly that we have the globally #1 for wellness joints. That is from Johnson & Johnson. We have done the #1 globally with 5,000 joints now in 3 years' time.
Really?
Yes, we have 3.5 years mostly. We are done with 5,000 joints and we are globally #1 in robotics for Johnson & Johnson company.
How much does the machine cost, sir?
That time it costed me 6 CR.
My God.
We have now 2.
And now AMC and all, how much is that?
It cost me around 35 to 40 lakhs per year for only AMC. And since we have volume now, we bought second machine as well.
You have 2 machines?
Yeah, with 2 robotics. Probably only one with a small setup like us, having 2 machines across the world probably. Only big centers like Kokilaben may have 2, but otherwise people won't buy that much.
But why do you need 2?
Because then I thought the volumes are increasing, I should have 2 just for backup as well. So you don't have to worry about the breakdown or anything like that. Secondly, we have 2 OTs, so I can simultaneously operate 2 patients together in a sense, one by one.
So you're closing one case here and the second is getting prepped.
Yeah, prepped. There. So it saves my time.
100%.
So it saves my half an hour, 45 minutes actually to set up a patient.
True.
So that's all it is. And since people have faith, people are coming, we have increasing numbers. I think second machine is just a good backup plus good help as well.
But how does robotics change the surgical procedure or the outcome? I don't know.
Yes, it has changed dramatically because something like if I am operating without robot, think of it. My assistant are my eyes as well. So they will say, sir, ye barabar hai, ye barabar nahi ho raha hai. I say, this is good or not. Then it's all hearsay, objective. Subjective, I'll say, subjective. We don't have numbers to match. We just feel and that we see, okay, that's fair enough. So if I cut something in a perpendicular to 90 degrees, I have no clue to understand if it's a 3 degree or 5 degree slope or it's a aberration of 2-3 degrees. Human eye cannot recognize less than 3 degrees. On a experienced eyes, forget about new eyes. So experienced surgeon can see 3 degree or 4 degree, but not less than that. And now that is a closer. If you have multiple angles in the knee, if you start aberrating on every other angle, you will end up in a bad situation for knee joint. And that's where the knees start failing. So with the robot, what robot does, it gives me a precision in terms of understanding the knee anatomy. It gives me number with if you see this knee, the ligaments on the medial and lateral side have the strength like this or like that. So it gives me a number on both sides, medial, lateral, how much is this extension, like full knee, and this is a flexion. So it gives me numbers on both sides. And once I remove this part of cartilage and I have to put the new one, I should get a good balance of these knees, ligaments, to make sure it works beautifully well, like a natural knee. So that balance is done with my brain power, with my understanding and experience, along with the robotics, where it gives me a numbers to understand that, okay, this is the number I have to come to. So I know how much to release, what not to do, what to do, how much to do. So robotic will help me in getting the understanding of a joint much more in a precise manner. So my point of my joint is put in a perfect way, so it doesn't tilt like this or that way, the plate, lower plate, and doesn't cause a loosening. So the life of a joint has to be it will be prolonging. We have much more accuracy, less pain, and more better function.
So it's basically just a visual system.
It's a visual system which gives me a feedback what I'm doing is right or wrong. So the important part is in a conventional surgery, if I operate something, I'll only come to know once I see a post-op result.
True.
Without that, all of us are reasonably blind. In a certain we have blind spots. We don't know about it. But here, before I make a cut, if I do certain adjustment on the computer gives me an understanding that if I do this, what is going to be the outcome?
True.
So my outcome is pretty fixed and I know before I cut it. So it's like almost doing a surgery rehearsal before I cut it. In conventional, we cut and even they see, oh my God, this has happened now.
True.
So here I get all the understanding of how I'm going to cut, what is going to be the option of cutting, what will lead to this because of these cuts and these errors, and what margin should I be doing was certain things. So I think overall it gives me a lot of precision in planning, pre-cut understanding, and again immediate result in front of me once I did surgery.
We use something similar in ophthalmology, sir. It's called our Varion system.
Yeah.
What that does is it is integrated into our microscope. So we can see there is a 3D axis happening in the microscope. It's in the eye. And we can see it is overlapping on the patient's eye.
Yeah.
So it tells us यहाँ पे incision लेने का है. It tells us second incision. Then when we open up the capsule, enter capsule, it tells us, it gives us a marker. So we can open it. We are supposed to have the rexus around 5.5 mm. So it basically tells us. And then we align the IOL, especially in toric cases, we have to align it at a particular axis. So it tells us this axis pe hai. And then when we are cleaning out everything, so it tells us if, during closing the case, it tells us if there is any retained viscoelastic remaining or not, and then it really helps. It really helps.
It has transformed surgeries now.
True.
There are a lot of robots. Now there are autonomous robots which do on their own. We don't use that. We use the Velis, which is the semi-automated, where I have decision power. I do all the decisions and it's executed by me with the help of robotic saw. Now what happens is
What is the robotic saw? Excuse me.
A lot of people believe that the robot is going to do surgery. I'm not going to do it. No. Surgical robots are different. General surgical robots are different. They can sit outside and do it. Here we have to go inside. We do all the opening. We do the planning. We cut the bones with the saw. Now the saw has got an array which will be picked up by the camera. And if I change the angle of the saw by a degree or even 0.5 millimeters, it will stop. So the saw will cut in particular precision what I wanted.
The plane will never live.
What I wanted has been cut by a saw and that's been held by me. So I am in total control and I cannot change what I decided intra just because I am doing a wrong thing. So computer picks up that and stops my thing. So that's a robotic assisted surgery. It is not robotic surgery, it's a robotic assisted surgery that is very precise, where my brain and his power of precision comes into play and gives a combined conjugated result which is really good for the patient, because my experience, my knowledge and the precision power of cutting will give us a perfect joint.
I always thought, today my doubt got cleared. Robotic surgery in orthopedics is just a visual system that like we use in ophthalmology as well. I thought it is like the Da Vinci system that general
No. That's where I'll tell you a funny incident. US based person came for his mother's knee, and the system was I just bought. I said we'll do a robotics. He said no, you have to do. I came for only you. We've been coming from 200 kilometers only because of your name, and you are the one who's supposed to be doing that. I didn't tell him anything. I said okay, I will do that. I went inside. I did robotic assisted surgery. What I do. Got a perfect result. Next day, I showed him the whole procedure, like what I did, what was the thing, what was the values, what we got in the end. And he was saying, oh, this is the way. Because he was thinking I'll be sitting in my chamber, doing something else, and I'll just control the robot and someone else will operate. So the understanding of robotic assisted surgery is robot assists surgeon in getting a precision, telling him what is right, what is wrong, and he can predict the outcome before he cuts it.
Right.
So that's what robotic surgery is.
So, I'm sure that you must be charging an extra for, you have to charge an extra for when you're doing a robotic assisted surgery. How much is the difference between a regular,
it depends
of cost? Obviously center to center.
But on an average, if you look at the whole worldwide or probably India wise, In metros, it's around lakh rupees more. In Nagpur, in my center, I will charge 30, 34, 35,000 because my charges are not based on the this thing. I have volume. So my volume gives me more flexibility in controlling the charges because I am using for every patient. Since the day I bought navigation in 15 years back, all patients were navigated. Since I bought a robot, all patients are robotic. We don't have choice of a.
So you don't give a
we
choice.
We don't have because see, when patient comes to me for Dr. Mahajan, he comes for a particular result.
Right.
And I know that I can deliver result because of either navigation or robotics. I cannot deliver the same result conventionally, though may I be able to. But now, since I am using that particular technology, I am so used to it that I am scared of not using that because of the possible lapses can happen, which I know of, I am aware of that.
Right.
So now I only tell them that you want a result, just follow me. Just give me the power to decide, and that's almost a patient don't argue about that, and they are okay with what I do. So charges are very minimal, but numbers are more, so the ROI is not an issue for me. And at the end of it, a happy patient and happy me is more earned. Actually, what I earn is more.
100%. I get that. Totally.
That part.
I mean, I've learned this from my father. You know, you always should invest in the best machinery that is, because if you as a surgeon can see better in terms of microscopes for us, we have the best microscope. The latest one we have it. We have the best phaco machine, and we keep on upgrading. कुछ नया launch हुआ है तो हमको खरीदना है. There is no doubt about it.
Because surgeons are as good as his instruments.
Exactly. So if we can deliver better outcomes, I'm understanding this now. If I can deliver better outcomes, I can start charging a premium on the services I offer, and I can be in. You know, when the people trust you, money then suddenly becomes not an issue afterwards.
I think creating a brand where you are being known for a perfect technology, perfect outcomes, and a great going with the result. I think that matters to the 100%. Patient. I understand. See, money is not something not to be underestimated, but when you give a value for money, that matters. A lot of people charge without giving a value for those things. It doesn't matter, and that's actually bad. So investing in a machinery is always the best because you get better and better with the more and more update of your own understanding of the problems. So I think technology is going to be staying there, is going to help you. It's the need of the hour and it's the need of the future.
I'll tell you, sir, in traditional phaco machines, you have to have at least 24 hours to 48 hours of rest.
Yes.
The kind of things we do and the kind of things I'm trained on, I have shifted mostly to topical surgery. So there is no local anesthesia. No. So usually what happens is you send a patient home. Ki, aaj ghar pe raho, maybe tomorrow show me and then go to work, or maybe take a day's rest. I offer a certain procedure. I'll operate you 7 o'clock in the morning, 10 o'clock, go to office. But then I charge a bomb for when I'm doing this.
Yes.
I mean, your working day, nothing is, no rest, nothing, you can keep on working.
Yes.
But I charge a bomb for this. And people are very okay paying for that, you know.
I think now people are there to pay you, provided you give them the result.
Exactly.
So I think that's not a problem for them, most of them. So today now I'll tell you with the robotics, we are probably one of the only centers across the country probably who send second day home for a joint replacement. So no one dares to do that, and a lot of people get amused. Why? How can you send? I said, if you get a perfect balancing, good outcome, patient have less pain, they are ready to go home. No one wants to stay in the hospital. How much cozy you can be.
Right.
People want to go home in their own bed, go to their own place. Even the people around them are more comfortable at home because they can serve good food at home rather than getting a dabba in the hospital. So everyone and the familiar surroundings make you more comfortable and more, actually you can be more healthy quicker than recover faster in your own environment rather than an alien environment.
Does your incisions become smaller?
I would not say that way, but I think they are more precise and they are more controlled. You don't require a big one, but I don't say the incision matters. What matters is the balancing. In a knee, it's a balancing of joint which matters, and that's the best part of it. Of course, incision, you can't take a foot-long incision, but whatever has to put in has to be taken in.
So 100% in terms of recovery, robotic-assisted surgery versus a traditional surgery, how does the recovery differ?
I think the recovery differs because of the balancing part.
Okay.
We cut less, we save more, we don't release the ligaments because most of things is done with the rotation of the joint and the particular way we do it. That's very technical, but that's the way how we do it. That gives less pain. Of course, now we have new pain pathways where we control pain because of multimodal analgesia, and patients are up and about next day morning to go home. So that's where the whole point is important, that we should be saving them actually a lot of time in the hospital, send them home, make them happy, and they are on their own comfortably walking around next day morning.
But then, what decides the surgery is successful? Actual surgery part or the recovery part also?
Now, there are two ways of looking at it. From a patient relatives, they ask you, once you come out of theatre, sir, surgery is successful. Putting a joint is not a success part.
I know.
That is for them.
Right.
For me, I see, it was success in those matter in there's something, there's an emergency, laparotomy or cesarean or something like that, where success and something is a instant moment. For us, putting a joint in a right manner, in a right joint, in a right space, with a good balance, that is going to be only seen after long term, in sense, a couple of weeks later, once he is absolutely fine, walking around, knees bending fine, that's success for me. To do his normal activities, going out, going to gym, going to swimming, cycling, and a daily activity of daily living at comfort. That is success for me and for the patient. But for relatives, initially they ask you, because of the old tradition, कि बाहर आके डॉक्टर बोलेगा हाँ ऑपरेशन सक्सेस हो गया. That doesn't happen. See, that, because sometimes a lot of mistakes have been only hidden inside the incision. It only won't come to know only after a few weeks.
True.
So I think the success for a patient is instant happiness and no pain, and for relatives, joint looking okay on the X-ray
and movement.
And for us, after 3-4 weeks, when the patient is mobile and happy, that comes the success part.
But then, what are some common mistakes you see people make during recovery period?
I think some people are too hasty. Like there are some guys who are full of testosterone, something like that, the men especially, they want to do everything immediately. But there are good people who listens to you. And I know surgeons and ophthalmic surgeon as well. You know him as well. He went to surgery on the 5th day. He started surgery. I know a gynecologist, a very eminent gynecologist, reasonably elderly lady in her 80s. I operated in 83. And she had some emergency at home. So after discharge, she went straight to the OT and did the cesarean because someone was bleeding. So I know people who have been instantly going, but I think you should take reasonable okay rest because of once in lifetime surgery.
True.
You should take around 15 days of rest within the house, not immobile. What I'm saying is you can be mobile within the house, but not going out of the house or doing activities which are not good for you before stitch removal. Once you are done with the stitch removal, you are good. I'm sure you can increase the day-to-day activities. And in 3 weeks' time, most patients are absolutely fine to drive a car or go out and on their own. But in India, two-wheeler is known for 2 months at least because of the condition of the roads and the stray animals crossing in between, you being bumping into each other on the busy roads, intersections. I think no for 2 months for bikes. But I say car is 4 weeks or 3 weeks is good enough for car. But you can drive, you can swim, cycle, gym, everything.
Again, robotic-assisted surgeries, do they need physiotherapy post-op?
See, physiotherapy is a matter of what you call education of muscles in a right manner. Now, a lot of people can do without it. A lot of people can do with it. In a sense, if like I always give an example of to a person that if your son is very good in particular subject, you don't put tuition classes for that. But if he's not good, you make sure he goes to tuition, so he'll be added certain knowledge, certain way of discipline and everything. So physiotherapy is an attempt where you have a trained personnel who will guide you in terms of rehabilitation. It's a very logical process to do because he will guide you not only knees, he'll guide you for hip muscles, your gait pattern, that is a walking pattern, how to deal with the spine issues, how to deal with the foot issues. So there are a lot of science behind it. So I think physiotherapy is not a bad thing. Only thing is, a lot of people have pain because physiotherapy, and they call physiotherapist because it is not because of them, it's because of bad balancing. If you do proper imbalancing don't do balancing of joint. If the joint is slightly this way or that way, it is very painful, and that's where the pain comes in. And if you do a robotic-assisted surgery where joints are very well aligned, absolutely no pain. My physiotherapists who go to patients home for their own physiotherapy, they become family members because they're so happy with everything. They believe, okay, I was expecting a lot of pain, nothing happened. So it's not a joint, it's a pain is not coming from the thing, it is coming from the imbalance of the muscles and the joint and the ligaments. So if you do it well, no pain because of physiotherapy, but it is an essential part of a recovery process in a graded manner and in a educated manner or medical rehabilitation. but you can get away without it as well if you're doing okay for on your own.
So when you were buying your first machine robot, did you face any pushbacks from people? Why you're investing so much?
No, there are always people believe that सब तो अच्छा चल रहा है फिर क्यों इतना खर्चा. I said, see, I should not be, as a surgeon, as a knee surgeon, I should not be dying without using a robot because it's an in thing, and I should not feel I have regrets that I have not done something which was supposed to be done in my lifetime. It's supposed to be done by me as well, because if I am doing well in myself, if I have no issue with any loan issues, anything, why should I not invest something which is really a world-class thing? At least I have pleasure of using the best in the world. I have pleasure of doing it in my own setup. And why should I leave that pleasure only for a money cost, which is not such something out of the world for me. A lot of people, a lot of surgeons have multiple houses, multiple farmhouses, multiple plots, but they don't invest into machinery. One person can live only one house, not even for a few hours. Forget about whole day we are living in a house, when we build a bungalow, something like that. So why not invest where you are spending a whole of your life into that? Your name is built on that, your brand is built on that. Why not have the best for the brand? Because that's what the long term your investment is.
True.
The investment is not only the money part, it's your own psyche which makes you more positive. Okay, I got the best. Like you have the best machine for yourself. So you're happy, you are proud, and you can deliver. You can deliver.
Yeah.
Same thing with me. Money doesn't matter after a certain time. Then what matters is the pride, the results, and the name going better. I think after 10 years of practice for any surgeon or any person in life, in his field, is not the money, is the name and the fame and the result. And people appreciating that part. What after certain 20 years for sure, no one wants money as a first thing.
No.
People appreciating your work is
Absolutely.
most important part. And I think if you get that with the help of robotics, that money is well spent. I have no regret. And I actually, very honestly, we are probably one who recovered very well because of the numbers, because of the result, and the results are going out and coming back with more patients.
Yeah.
So I bought a second one.
Yeah.
So for a small setup like mine, less than 20 beds, we have 2 robots, people are unheard of. But I think I am one person who's crazy about instruments and equipments, and I put every time, I probably buy 20% of my income into instruments every year. So my take home is maybe 80%, but still 20% is good amount to invest every year, and every surgeon or every entrepreneur should do that, to reinvest, because that's where your progress and the connect with the world, you are with the current trend, only because if you invest properly.
Very true. That actually is a lot of my friends debate over this कि क्यों इतना महंगा मशीन लेना है
जब चलता है दूसरे से
चल रहा है like
I said inner satisfaction is most important.
हाँ मतलब I don't know, I mean somehow I'm wired differently, I guess.
No, I think we have done the right choice, you and me both probably. I always believe that going with the technology is important, because at the end of it, you don't know the lifespan. But if you do a good job on your own, and you have used the best of the world, sitting in Nagpur. See, when I come from UK, my point was to recreate something better. Now today we have machines which UK people don't have, because they have limited funds of those things. Now we are the one who can afford it. And people are giving back. It's not something I'm only using and then no, people are paying for that. Of course, they're getting results. So once you invest in the right way, it delivers a result. And I think for us, patient matters the most.
My boss used to say, sir, ki your patients are your best branding managers.
100%.
You don't have to spend anything on social media.
If you see
your patients are your best PR.
Yes, I think I believe 110%. We don't have a page also. Forget about, we don't have a Facebook where we start, like every day people put, I did this, I did. No. We are doing enough. People know about it. People are coming back. They are sending good patients.
True.
And they are the brand ambassador for me all over the places.
I really enjoyed this conversation, Chalo, before I let you go, sir, people in 40s, what should they do about their bone health?
I think first and foremost, you should look after your intake of calcium, vitamin D, and regular exercises. I think regular exercises make 2 things. They make you fit, they make you mentally agile, and they keep your muscles and bones in the right shape and the right manner. Important is to lose weight in the right time. To make sure there are, nowadays, don't go on medication, but you can do that in the early 40s. And I think be positive about everything, and not to play After certain times, if your knee is not the best one, don't play contact sports. Play something different. You can do cycling, you can do swimming, you can do basic gym. Jumping and all these are not the best ones. If you have bad knees, I always tell patient not to go for a contact sport, even not a badminton, because you have a lot of jumping activities lead to a lot of friction actually across the joint.
Right.
So biking and swimming, cycling or gym is a good part then.
If somebody is going for any joint replacement surgery, anywhere, what are the few questions they should be asking that particular
Yes.
doctor or that at that center?
I think first they should look up the person's experience, the surgeon's experience. His results, of course, we don't have a major in India to know the result. Otherwise, a lot of worldwide they have registry where they can look up surgeon's result, how good they are. But I'm sure in the neighborhood, you should not only try because someone is cheaper. Doesn't mean all surgeons who charge less are not bad, but doesn't mean always charging high is always good. But you should know what is optimum, because if you charge something less than normal, that means something is compromised somewhere. So first you should look for experience. Make sure this is a health clinic is very clean and all. You have a good OT setup. You should have a few things like laminar flow systems, personal systems. Robot or no robot is your choice, because there are costs associated with that part. But if someone can offer you a good solution, experienced surgeon with a robot, nothing like it. Both, it's the best of the both world, experience and the robotic together. An important part is what material is using. I think there are so many Indian brands coming up. To be honest, I love India, but Indian brands are still lacking in terms of far away from the world-class brands. So there are 2-3 companies we should look for. Johnson & Johnson, some other Smith & Nephew, Stryker, 3 worldwide companies, Zimmer. So those are 3-4 companies which are worldwide the best. I think you should only look for that. Indian brands, they may offer cheaper, but they are not at the moment. At the moment, maybe 10 years down the line, they may be different, but I think at the moment they are not up to the mark.
Far away
At
from least
that.
ophthalmology.
Same in the orthopedics as such. Because these implants are for lifetime.
Yeah.
Something for trauma is different, because only for 3-4 months in the body till the bone heals. This is lifetime surgery. You should invest something like perfectly good.
Same thing for an intraocular implant, right? एक ही बार होगा.
Exactly.
It's very difficult to take it out and put it. It's very complicated.
I think people look for cheap options, but cheap option always good. Because one surgery, I'll tell you one simple. If you have a surgery, you may have a difference of 50,000 or something like that between 2 surgeons. But if he does a bad surgery, the outcome of a revision surgery cost is around to 7 to 8 lakh rupees. So sometimes even infection around 10 lakh rupees. So for one joint. So if you're looking at the joint, you save only small amount, but you can actually make yourself pay more in case you go for a wrong one. So by saving those 50,000, it's not worth it, because the amount of revision surgery, cost of revision surgery is absolutely beyond many people's reach. Many people's reach. Nowadays, with a lot of PMJY or Pradhan Mantri Yojana, everyone is putting a joint in, which is a local joint, which has no due without a proper care, because the amount paid is only 80,000. How can you get a 80,000 something which is worth more than lakh rupees for a joint in the 80,000? So there are a lot of corners are cut, and that leads to a massive rate of infection and failure. And those unfortunate people who are poor enough not to afford a proper joint, they will end up having a lot of revision surgeries which they can't afford further, forget about a primary. So I think there's a huge epidemic coming up around with the infected joints and a failed joint because of the low cost solutions offered because of the PMJY. And unfortunately, you people are not aware of that. They are believing that it's a free, so we can get it done. No, not everything free is good. And so I suppose one should look for those part, make sure the experience, the implant and the whole thing as overall. And at the end, you carry 1% luck with everything what you go around with.
Do you get arthroscopic procedures mostly?
We do arthroscopy as well, but those are the procedures which are meant for only young patients where there are ligament injuries, contral injuries, or meniscal tears, or loose body, something like that. And arthritis, the arthroscopy doesn't matter. Once you set in arthritis, arthroscopy out of question. It's only for a young sports injury. And injury where arthroscopy is absolutely fantastic. It's a keyhole surgery, which is perfectly fine, and they do very well.
And you don't need the visual system for that?
No, we don't require those things. We don't require, because it's all seen through the camera, and it's a high HD vision. So you don't require those things because there's no alignment issues. See, with the hips and knees, we require alignment to be perfect. And that's where all those visuals are coming in. Here, we just have to do what is supposed to be reconstruct ligament or do something, which is completely a normal biological process which you have to follow.
So how long does a ligament reconstruction take?
It around 35 minutes, 40 minutes to job, and it takes around 6 months to heal completely. If you're doing an ACL, which is the commonest ligament to replace, it's around 6 to 8 months to get back to normal things. It's a month's time to get back to reasonably okay, but around 6 to 8 months to get back to normal sports. It's a fantastic surgery which gives very good results, and I think it saves the knee actually. Because if you have an ACL which is not there in the knee joint, your knee will wobble and can become unstable and can lead to early arthritis. So those surgeries are good for those young guys who have a ligament injury, should be treated. If you don't treat it, you will end up in more trouble in long term.
But partial ACL tears में तो lot of time
No,
you
see,
let it be
fibrosis. Depend upon the tear.
Right.
It's a full tear, we have to replace. If the partial tear, a person is not very athletic, he has only housework or he's a sedentary worker, he doesn't require, he can build up the muscles and get away without it.
Right, true. I had fun. Thank you, thank you so much.
My pleasure. And it's an honor to be here on your podcast.
Any closing thoughts, sir?
I think joint health is important. Like heart, joint is also important. A lot of people will look after heart. I think look after the joint and have a healthy joint with good nutrition, good exercises, good muscle power. And hopefully you don't require to see me, but if you require, I am there for you. And nowadays joints are so good, don't require to worry about next 20, 30 years. One important before I go, a lot of people believe the joint has a life of 10, 15 years. No.
Right.
Present joint life is around 30, 40 years.
Right.
So it's a lifetime surgery only once. So don't worry. There are options if there is a problem.
But a good thing. Why do people think that joint...
No, because the previous era joint in 70s were having this poly was a problem.
This thing wears out.
This was wearing out.
Right.
Now with the cross-linking, these are stopped wearing. So there is no wear and tear of the joint. And now designs have changed, materials have changed compared to what it was before. So lifetime joint is there. Sorry. It's around 30, 40 years plus more than that, not less than that.
But then why are some patients asked to lose their weight before getting a surgery?
I think that's a very common notion for people to ask for losing weight. But personally, I don't ask them because the people have arthritis. They can't do anything. If a person like me who's otherwise fine can't lose a kilo in a couple of months, how can you expect a person who's a diseased joint can do walking, running, marathon or what sort of exercises? So it's very unfair people to ask for losing weight after certain diseased joints. Once the joint is gone, you don't ask for it. You just go and replace the joint. Now there are options of putting a small rod across and all those things. So we can still do in an obese patient. But less weight is always better.
Obviously.
But certain people you can't ask for weight loss because they cannot do anything about it. So I think we just have to go do it. And this works very well. I do around, my 30% patients are overweight.
Okay.
But I can't ask them because if they will never be coming back and they live miserably because of the painful joints. Now they have two misery. Not losing weight and not having a good joint. So pain is one cannot live with.
True.
So I offer them solution all the time, irrespective of the weight.
Sure. Thank you so much, sir.
My pleasure.
This was such a learning experience for me, and for people who are watching this, I mean, there are a lot of takeaways for people, and if you want to ever see sir, I mean, just Google him up, you'll know where he is. He's a very famous guy. Thank you, sir, again.
My pleasure. Thank you so much.